what I define as the future of our profession is from the technician to the overall health expert. What I'm training is Biodentistry 3.0, which is the, let's say, the melting of the high-tech skills we all need. Conventional dentist, biological dentist, doesn't matter. High-tech skills, melting with functional medicine, integrative medicine, health optimization, or biohacking, whatever you want to call it, to help people on their journey to optimal health, just starting in the mouth. And that's protocols that are time tested. Like for over a decade, our clinic in Tübingen, Germany, where I'm at right now, is a destination. It's completely different to conventional dentistry, conventional biological dentistry, where it's more like you see a lot of patients a day. It's more like fast food versus what we do is more like a menu style approach. You stay there for a week, 10 days, 2 weeks. And we take care of it all, of all the previous dental repair that has been done in a protocoled way. So that's what I'm bringing to the world, to have that impact, to literally change our profession. It's just the next level, from the technician to the health expert.
Hello and welcome back to the Smarter Not Harder podcast, your home for 1 cent solutions to $64,000 questions. I'm your host again today. My name is Dr. Scott Sherr, and it's a pleasure to be back with all of you. Today's podcast was a really fun one to record with Dr. Dominik Nischwitz. Dr. Dom, as he is known, has become a good friend over the years, and he's a pioneer in the world of functional and biological dentistry. And he's written books, he has supplement companies, he does lots of speaking and touring, and does amazing work in his clinic in Germany. And so it was really fun to have him on to talk about his pioneering work and what he's up to these days. Here's a bit of a bio on Dom. So Dom is widely known as Dr. Dom. He's a pioneering figure in biological dentistry, blending advanced dental techniques with holistic health principles. He co-founded DNA Health and Aesthetics in Tübingen, Germany, a center dedicated for biological dentistry, and serves as the vice president of the International Society for Metal-Free Implantology. Dr. Nischwitz has placed over 5,000 ceramic implants, and in this podcast, I figured out there's a difference between an implant and actual crown. That was new to me today, emphasizing the use of biocompatible materials to promote overall health. He's also a certified naturopathic practitioner, has developed protocols like the Bone Healing Supreme Protocol and the Food Design Concept, focusing on nutrition's role in oral and systemic health. He's an international speaker, educator. He's created something called Biodentistry 3.0 certification program through his Institute of Biological Dentistry, where he's training other practitioners, other dentists on how to do what he does. And he has a book also called It's All in Your Mouth as well. So Dr. Dom and I have known each other for a while, and it was really fun to kind of dive in to a whole bunch of different topics that he talks about oftentimes, but also kind of dovetailing in various directions that were a little bit unique for him as well. Of course, we started the conversation talking about what is biological dentistry? Why is it important? What is different about biological dentistry, versus regular dentistry? Then we also from there described, what is the mouth as far as how it's related to the rest of the body, and why does all disease, technically start in the mouth? Was the mouth going on, what's going into the mouth from a chronic inflammatory perspective, from an infectious perspective, et cetera, and how that all is so important systemically and how you approach the mouth in that capacity. We then gravitated towards talking about cavitations, metal detox, ceramic implants, and then I found out there's a difference between an implant that goes into the bone itself versus the actual crown itself, which is the actual tooth. Again, this is from my knowledge, and maybe some of you didn't know this either until this podcast, but this is where I had some interesting education from Dom today. We talked about cavitations and silent jaw infections. We also spoke about what happens is actually when the bone gets infected from having gingivitis and actually gum disease, that's actually getting into the bone itself and can actually travel to the brain, and how this is associated with things like chronic pain, trigeminal neuralgia, for example, maybe even associated with cognitive impairment, neurodegenerative disease, Alzheimer's, et cetera. So this is all extremely important. We then talked about Dom's process of how he actually optimizes the mouth, and he has a full spectrum approach here, which I really appreciate, looking at downregulation of the nervous system, IVs, supplementation, things like vitamin D, of course, but looking at things in a more holistic way, not only before surgery, during surgery, but also after with the bone healing phases. And we talked about supplementation with all these aspects as well, and how he's really creating a whole healing program for his patients, and not just as he calls the steak of his menu, which is the actual surgery itself, but the aspects before, during, and after that are so important. From there, we talked about the oral microbiome and spoke about how in the oral microbiome, it's so important to think about not nuking it, but also how to support it, sometimes with probiotics in the mouth, but also what kind of toothpaste should you be using? Should you be oil pulling in the mornings, flossing, and also tongue scraping as well. From there, we focused on myofascial aspects of the mouth, which are really important as well, and then so much more. So I really hope you enjoyed this podcast with Dr. Dominik Nischwitz. He's a fantastic human, a very great educator, and really on the forefront of what's going on in the mouth. And if you do like this podcast, don't forget to like and subscribe below so you never miss an episode. Enjoy. Dr. Dom, it's good to see you, man.
Good to see you, Scott. Very cool.
You know, we've been talking about doing this for a long time, getting you on the Smarter Not Harder podcast. And it's funny because when we first launched this podcast, like almost 2 years ago now, maybe a year and a half, I was like, Dr. Dom has to be one of my first guests because he's the leading expert in biological dentistry. And it's taken us this long, but you have 4 kids and I have 4 kids and you have how many companies and you're doing surgery. How many days a week are you doing surgery at this point?
2 to 3.
And those are long days, I'm guessing, when you have those days, right?
Yeah, those are long days. I try to compress, obviously, but it's long days.
And then you're also training other biological dentists around the world and creating standards in this whole field and, you know, pioneering all that, which I want to talk about because as a clinician myself, I'm always trying to find biological dentists for my patients. And it's sometimes hard to know which ones to send people to and which person is just like the person saying that they're a functional dentist or whatever, and one that actually has been trained in a standard of care that I know you've been pioneering for a long time. So very excited for all that. But before we get into some of the details and some of the novel things that you're doing, I think it'd be really helpful, Dom, you've created this field in a lot of ways on your own with very few people. How do you define biological dentistry as it is now versus maybe you can give a little bit of historical sense of like maybe how you started with the process and how it kind of evolved to what it is as you think about it now as well?
So yeah, we touched on that before, but biological dentistry, the way it's now is literally not a standard. There's no trademark. It just basically means if you do an average of all biological dentists, most of the time it means we're using more biocompatible materials, no more metals. But as soon as we talk about root canals, there are people that are doing biological root canals and then they don't know about cavitations. So there's literally a wide realm of things. I've even seen patients that went to see a biological dentist and the only thing biological was like a singing bowl playing next to the surgery. So it also goes
Nice.
a little bit in the woo-woo. Yeah, and the problem is, for all
Energy
the patients
medicine
out there, I cannot just tell you to see a biological dentist. It's like telling you to see a trainer or a real estate agent or any sort of doctor. And therefore, even though I've trailblazed the name biological or the word biological dentistry over the last decade, I think it's time to clearly define what it means. And what we do is the next level. What I define as the future of our profession is from the technician, and biological dentists mostly are just technicians, from the technician to the overall health expert. What I'm training is Biodentistry 3.0, which is the melting of the high-tech skills we all need. Conventional dentists, biological dentists, doesn't matter. High-tech skills, melting with functional medicine, integrative medicine, and health optimization or biohacking, whatever you want to call it, to help people on their journey to optimal health, just starting in the mouth. And that's protocols that are time tested. Like for over a decade, our clinic in Tübingen, Germany, where I'm at right now, is a destination. It's completely different to conventional dentistry, conventional biological dentistry, where it's more like you see a lot of patients a day. It's more like fast food versus what we do is more like a menu style approach. You stay there for a week, 10 days, 2 weeks, and we take care of it all, of all the previous dental repair that has been done in a protocol way. So that's what I'm bringing to the world, to have that impact, to literally change our profession. It's just the next level, from the technician to the health expert.
Right. So you're talking about more of a full spectrum way of looking at health, but starting with your sort of expertise, your astral expertise, which is in the mouth. And oftentimes you talk, and you actually have a book of this title, talking about how all disease starts in the mouth or health starts in the mouth. Can you talk a little bit about sort of the overview of that and how you can see it as a window for the rest of the body? And I know there's a lot of different ways we can go here. And I love that you're taking more of a health optimization approach. Of course, you know, this podcast is sponsored by our nonprofit, Health Optimization Medicine, which looks at that foundational approach. I know it's a big part of what you do. What does that approach look like for you in the sense of, and maybe give some examples of what you mean by all diseases, like all disease starts in the mouth, and how that kind of reflects in your practice and the way you think about, you know, bringing people to your office and how they have your 5 or 10 days with you in the office too?
Yeah, so I would always say optimal health or health starts in the mouth. For me, the mouth is the entrance to the body. It's kind of like you have a body. It's more like let's say it's the hotel. Most people talk about gut health, and the gut actually is the mouth. It starts in the mouth. It's the entrance, that tube that starts here and goes right until the end, right?
The anus, yes.
This could be the hotel lobby example. And if you had previous dental repair done, the hotel lobby could be very shitty. And this also would be affecting your gut system. Then also you have to understand that the mouth is also first contact with everything. So there's a huge immune system. There's a huge microbiome. The second largest microbiome in the body to the gut is the mouth. Obviously, we also have a skin microbiome, various different ones, but the oral microbiome is very, very diversified and changes a lot due to the substrate we're eating. Like if you're eating a standard Western diet, it's completely different microbiome than if you eat a paleo diet, for example, or vegan. Also, the mouth has obviously all the enzymatic activity. The digestion starts there just by chewing, but also just the saliva. And as a conventional dentist, the mouth is seen as kind of like outside body. And there are teeth in it, and teeth are just tiny, hard biting instruments. And usually in dentistry, you can repair those if they had a tooth decay, like a cavity, or if they hurt, or if you have bleeding gums. You just repair things. You're just fixing or patching up a tooth or a gum, instead of looking at it as the mirror for the overall body. Because when you're decaying in your mouth, it's a sign that the overall body is in decay mode because you're lacking certain things. Because in nature, your teeth should be hard as stone, like granite, not like soft. So constantly in the Western world, especially, we are living in a state of so-called demineralization, meaning our tooth outer part, called the enamel, is constantly losing its mineral components instead of being rebalanced or remineralized all the time. And this has a lot to do with lifestyle. Dentistry, up until now, and still is, even though that's the way you learn it in university, is just how can we fix this? How can we fix this tooth at the spot? But there is no connection with these teeth in your complete body. However, the mouth, like I just said, is the entrance to the body, and a tooth is an organ. It has a blood supply, it has a lymph supply, it has an autonomic nervous system, and we have about 32 of those directly on the trigeminal nerve, which is one of the main 12 cranial nerves. So it's super, super important. That's also, guys, why tooth pain is so insanely painful, because it's straight into your head, migraine-ish, because it's just the nerve. In essence, the mouth is just part of the body, and we should not neglect it. And when it comes to, let's say, health optimization or biohacking, the question you should ask yourself is, are you doing everything already? Like if you're already having your diet on point and you're taking your supplements and you go out in nature and you do hyperbaric and you do some IVs and you're mindful, but you still have some, let's say, chronic nagging health issues, could be skin issues, could be mental issues, could be hormonal imbalances, could be thyroid issues. You name it, fill in the blank basically, and you're not sure how to fix this, then it should be time to look into the mouth from an overarching perspective. This is where Biodentistry 3.0 comes in. So if you do everything correct, but you're still not superhuman or perfectly healthy, then it's time at least to find maybe the missing link to overall health. It's oftentimes the mouth. I
love it. It's a good reminder about the trigeminal nerve. Can you talk a little bit about the trigeminal nerve and how it interacts with the face and how people, this is a little bit of a side note, but trigeminal neuralgia is a big problem, right? I see a lot of patients with this over the years. I've heard stories, and I'm sure you've had these experiences where you take something out of their mouth, an old cavity or a cavitation. And I want to talk about a little bit regarding some of that in a minute. But like as a window of what you've seen, you can think of some of the stories of some of the people that you've seen that came in with some of these conditions, and then all of a sudden you did something to their mouth and it's like, holy shit, like they're a different person, that kind of thing.
Literally all of them. Like this is the way we design it, because to see us, you kind of like have to apply for an appointment. We ask for your panoramic x-ray to just have an overview of what has been done previously at the dentist.
Sure.
So we ask 3 questions: metals in the mouth, root canals, pulled wisdom teeth, to touch on that cavitations. So plan all this. And therefore, obviously, it's a long distance. But as soon as we take care of something called oral interference, so metals could be a trigger, don't necessarily need to be, but could be a trigger. You didn't come with metals on this earth, right? Metals in your mouth are not part of it. That's dental repair. We also had all healthy teeth. So root canal is another thing. And then these cavitations is usually what happens if you take out teeth and you're not prepared. So, and because we're doing wisdom teeth most of the time, I'm asking these questions because in 80% of all cases that happens. So we plan the whole case and prepare our patients so we know if we now take care of this and kind of like bring back the time and take these things out very minimal invasively, there will be an effect systemically because they're all connected. So the trigeminal nerve And on top of this are your teeth. So the sensitivity of your teeth is actually connected to that nerve. And like you said, trigeminal neuralgia is actually, I think, even in medical literature, is about 80% we don't know where it's coming from, right?
Right. It's very, very often idiopathic, and they give terrible drugs that cause multiple different side effects, and they're nasty. And I've used hyperbaric therapy for it over the years, but it's typically not very helpful if you're not also, doing what we're talking about here.
Exactly. You have to find so me, it's all about finding the root source of the problem and what can cause chronic inflammation. We know that chronic inflammation, chronic stress is, let's say, at least 80% contributing factor to chronic disease. Yeah, we just know that. So trigeminal neuralgia oftentimes is actually contributed to something that has been done previously. Oftentimes it's actually could be a root canal treated tooth. No kidding. It could be these cavitations in the jawbone, which is chronic silent inflammation in your jawbone, oftentimes directly around the trigeminus. And the trigeminus is actually transporting nutrients, parasites, viruses, fungi, whatever is in your mouth, retrograde into your brain stem, like straight into your hypothalamus, straight into the ganglia, so they can all be affected. So when it comes to neuralgia, I would never say the main thing is dental repair, but it is definitely a huge contributing factor. It could also just be heavy metals that are in your mouth. These silver black fillings contain mercury. Most toxic non-radioactive element known to man travels from the tooth directly into your hypothalamus. And pituitary, good studies showing, especially in dentists, they have a load of mercury toxicity in their pituitary. And the Mad Hatter's disease. We all become Mad Hatters because we're inhaling too much of the mercury if we don't protect ourselves. Stuff I'm teaching. And
goodness, yeah.
If you understand just cytokines, if you understand chemokines, if you understand chronic infections like anaerobic bacteria, parasites, viruses, fungi, they're not local to the teeth. But if you have a root canal, that's a dead tooth, the perfect cave, the perfect shell, housing project for these anaerobic bacteria or parasites to live in there.
Right.
And as a normal dentist, we don't focus on this. We just focus on, can you bite on that tooth? And of course you can.
It's
but
dead. Yeah,
we never asked the question, is this connected to this overall system? And could this be the splinter holding you back from getting rid of your trigeminal neuralgia? Or oftentimes I work with a lot of ENTs. So ENT sinus issues are also oftentimes idiopathic, but they're actually not. Because I would guesstimate at least 60 to 80% we have a root canal or some sort of dental repair on one of these molars up there that stick directly into the sinus. What I see oftentimes is like crazy surgeries, like cleaning out the sinuses and stuff, but they didn't take out the root source, which was like sticking in there, just a dead tooth.
Yeah.
And why would, you're a doctor, medical doctor. No medical discipline would allow to leave something dead in the body, right? Think about a gangrenous foot or toe. Definitely needs to be cut off, right? And sealed because it spreads. But in the mouth, it seems to be not important. It's literally like a lot of dentists make their money with endodontology, which is root canals, and I respect them. It's a very fine art, but when it comes to supreme health or just being natural healthy, it doesn't work. It's just a dead thing.
I was thinking about neurodegenerative disease, specifically, and the idea that, we used to think that Alzheimer's disease, for example, you get all this amyloid plaque in the brain, and this amyloid was causing, Alzheimer's, but we now know that a lot of those studies were debunked and they were faked back in the early 2000s in some of the pictures. But there is a lot of amyloid there. And we think that the amyloid, at least for some people, is likely there as a protective mechanism, right? So potentially for some of these infections that you're talking about, where you have these dental infections and the body's trying to create a response to it.
And we know that oral bacteria, there's a big microbiome and I think they found up to 700 different species of bacteria, but the 5 we're learning in dental school, the evil ones for tooth decay is Streptococcus mutans, and there's also Porphyronas gingivalis. And if you check Porphyronas gingivalis, it's actually strongly linked to Alzheimer's and also neuroinflammation. So they found that if you have leaky gum, which is basically leaky gut in the mouth, bleeding gums, that's leaky gum. These Porphyronas bacteria can just jump, or every bacteria can just jump into your system, because gum is skin, is outside body, but below is bone, and bone is inside body. And from there, you find them causing microglial inflammation in the brain, and they're coming from your mouth. And oftentimes the root source for those are cavitations where they live in or hide in, or dead root canals. I can tell you straight away, story from Brad. He would probably go here straight away and give this life to you, because he had he didn't have microglial cell activation, but he had joint pain issues, like literally rheumatoid arthritis. And he has seen like all the best doctors worldwide. Was even I think it was even Mark Hyman or like in that clinic. So health optimization to supreme.
The functional side, yeah, sure.
Functional side. Yeah. So he did everything, literally everything, and he always had this super high rheumatoid arthritis factor. And then also he did. Yeah, he also did some oral microbiome testing, and he always had high Porphyronas gingivalis, which is directly connected. So there's a strong correlation. And he came to see me for whatever reason. He was there, and we just did the normal approach. Prepared him well, took care of all the metals. He had a couple of root canals, and he had a huge cavitations from the wisdom tooth removal. We took care of this, and literally on the next day, he gives me an interview. He says, like, people don't want to believe this. They're not going to believe this, but joint pain is already gone. So we followed up because he's like really nitty gritty when it comes to his blood work and everything. So 4 weeks later, he sent me the first report of his new oral microbiome scan. Porphyronas gingivalis 4 weeks later, completely eradicated. It's just gone. Joint pain also almost gone. And then he sent me 6 months later, I think, when he came back, no more joint, even the rheumatoid arthritis. It's like all gone. And this took him 10 years because no one looked into his mouth. So that's what I mean. If you're already trying everything and there's no change and you try it over and over again, like that's insanity. You have to just find new things. And oftentimes, let's say the trigger might be hiding in your mouth, in your jaw, actually. And most dentists won't tell you this because we're just not trained that way. That's why I mean, we are doing the next level because I feel most people out there hate to go see the dentist because it's usually painful. They usually just do a patch job, and I call them guests or our patients that fly in from all over the world. They really look forward to it. It's like they see you, right? Because they know there's someone that's taking care of the whole body and starts in the mouth. And obviously we have to repair what has been repaired previously. Ideally, we don't need a dentist in the first place, right? No repair in the future for our kids, hopefully.
Yeah, no, I love your perspective, Dom, and I think it's so important. And I'm one of those people that had a really multiple bad experiences going to a dentist. My father was against using any Novocaine for cavities, and I didn't know how to actually brush my teeth very well. And so as a result, accommodation wasn't very good. Lots of cavities, lots of fillings, all those kinds of things when I was younger. And there's a lot of people I know that are similar to that, where they had bad experiences with the dentist. They don't think of it as someplace that's keeping them healthy. It's a place that's causing them pain. And I think having the capacity now, as you know, to be able to keep the dentistry that you're doing to be less painful is a really important part of this. And maybe that's a good place to go, because I think that, when you're thinking about, doing some of the work that you're doing, right? You're doing cavitation work, you're taking out root canals, you're putting in ceramic fillings. And for those of you listening, I spoke to one of Dom's good colleagues here, Cody Krieger in Iowa, and we talked a lot about this too, and talking about the details of all this. But like, what are your main, and I'm going to talk about some of this too with you, but I want to take it to your sort of 3.0 level too, Dom. And what are some of the ways that you kind of address pain, or you make sure that it's a comfortable experience for people that are kind of going through 5 or 10 days in your office and doing these kinds of things with you?
Yeah, so literally it's all about the preparation of our guests so that you're in a supreme healing mode. And then we have on-site, we have kind of like a complete health optimization biohacking facility where we use hyperbaric. I was trained by you and have the protocols, hyperbaric, red light bed, intravenous nutrition, various. We even have laser in the veins. We have everything that you can imagine.
You have the Weber? You have the Weber laser? Which laser?
Yeah, the Weber laser.
Nice.
Ages. Yeah. Well, that's really a good one. And we even have hypoxia training. So we have really tons of things just to make that stay as good as possible. Kind of like I said, like a menu. So that the dental intervention or the oral intervention becomes maybe like the steak in the menu, but it's really like not the biggest focus on it. There's obviously always, because I'm a surgeon, they think about surgery. There's a little bit of the mind game because, like you said, they had bad experience in the dentist. But I always tell them, or my nurses or assistants do, see it as like a new start. It's something completely different. We're taking care of your optimal health with all these protocols I'm running and being super, super precise and minimal invasive. And I've been called neat. I'm an extreme empath, so I feel your pain. Imagine being a surgeon and an empath at the same time.
That's not a good combination, man.
No, it's really bad combination. But you get to a level where you like become a craftsman, and it's more like an art. We do everything scarless. So like no vertical incisions, nothing. So there's literally, most people document almost no pain, almost no swelling. Some even have zero pain. So if I, for example, one of my specialties, so to speak, is an immediate ceramic implant. So imagine you would come to me and you have this tooth being a root canal. Mm-hmm. You don't want to have that pulled and then run around with like a gap in between and then the usual story would be we see each other again in 3 to 4 months. We do a cone beam scan. Then we see, oh shit, all the bone is gone. Excuse my language. All the bone is gone. We need a bone graft. Another 6 months take time. And then we do the titanium implant. And then another 6 months later, you get your crown on top. Is this something you want to have? No. What we do is prepare yourself, obviously. And once you're here, there is the option of taking a tooth out. No yanking, guys. Literally, it's a stretching movement. You can literally wiggle it out without touching your gum and the underneath bone. That's the trick number one. Then you have that pure socket.
Okay.
And that pure socket needs to be cleaned and disinfected because that tooth was really like infected. So
Right,
what we use is ozone. We use PRP, PRF, everything that we can use there. PRF is basically what we do. We draw blood and we spin it. And then we get the plasma, which is the white fraction. It has loads of like different cells in it, even peptides and healing components. Let's say it's just like a miracle membrane. Like there's also fibrin in it. Kind of like if you have a wound that is already healing. So I'm using these membranes. And then because I have that socket, that's called socket preservation. We put an immediate ceramic implant, not metal, not titanium, straight into the socket because this will make sure that this socket doesn't collapse, which is normal. If you don't do anything, your body doesn't use it, it loses it. It's called alveolar atrophy or atrophy. So we use that ceramic implant. Everything that is like hollow around it or blood will be full of these membranes. And this will close the gum. And the good thing about a ceramic implant is it's a biomaterial. It's also medical guidelines since 2 years in Europe. And the gum will close the gap. It attaches itself. It grows really tightly on the ceramic. So we actually have, more medical speaking, an endo-exo-prosthesis, which is usually not happening. With metal, which is the gold standard, is titanium still, that doesn't happen. No gum will attach itself to metal. We're just not Terminator. So we need something biocompatible. But you see, for me, the ceramic implant is just a tool to restore your bite. That's it. I'm not focusing on a ceramic implant, but if it would be me and I had that tooth out, I want to have a ceramic implant straight away. Saves me probably at least 1 year and multiple appointments with the dentist. So obviously this then needs to also integrate. So all our guests know exactly what to do for the next 4 to 6 months, systemically in terms of nutrition and bone healing protocols so that this will be stable. They also get a temporary on top so no one sees it. And then when they come back for stage 2, which is called prosthetics or function and the aesthetic part, just crown work, then they're usually so much healthier because we're on that protocol for 3, 4, 5, 6 months. The implants are also integrated and we then give you the final teeth. And the goal is to never see you again as a dental patient. That's it.
I love
Once
that.
And for all.
Yeah.
And ideally, obviously, you will never lose a tooth in the first place, but you come to us with a root canal. That wasn't on me. So your kids, everything is nutrition and lifestyle and functional medicine or functional dentists do a great job there to train kids from an early beginning. Because like I said, the worst thing that can happen to the tooth is the dental drill. That's called the dental career. Drilling, cavity, root canal, dead tooth, out, titanium implant, metal, not good. We need to change this. But for now, there's so many people suffering from chronic disease that have the mouth full of previous dental repair. We have to fix that.
Yeah, I think you're not going to be.
Way. That's why they fly in.
Yeah,
it's really
I think
painless.
Yeah, totally. I mean, I think you're not at a dearth of patients. There's always going to be patients for you, Dom. I feel like, because I mean, it's like, but I love your idea, and I talk about this oftentimes as well. Is that the goal? Is that you don't need to see me very often because you're doing so well with the things that are keeping you optimized. And I think your window into this is the mouth, which is super cool. The way I would be thinking about this is on the health optimization side, but I would be also referring them to people like yourself to optimize in these various locations because we know that the mouth is such a big piece of this, along with, of course, other aspects of things as well. When you were talking about ceramic implants, you were talking about how the ceramic can actually engraft compared to titanium. Is that correct? And is that what you mean? Or is it that that's just a temporary until you put in the prosthetic?
No, actually, so an implant, for guys who don't know what that is. So if you have lost the tooth completely, we have to give you a new root, right? Because the tooth came out completely. And the root in dentistry is called implant, dental implant. And if you Google this, or if you search for this, or if you ask your normal dentist, they will probably tell you it's going to be a titanium implant. So that's a metal. And titanium is the gold standard for 40 years, and it works. Not a question about it. But it's a metal, it's a foreign body part.
Right.
It
right.
always has some issues. This one needs to osseointegrate too. Ossification of the bone takes about 3 to 4 months if you're in a healing mode, because these tiny cells that build the bone, called osteoblasts, they're just super slow. I just imagine them like tiny bricklayers doing brick by brick. And this just takes time, and it's depending on your own, let's say, body anabolism. That's why nutrition is so big for us, and supplementation and all the things, because if you have a lack of nutrients in the first place, you won't build it. And then the ceramic implant just don't osteointegrate. Then you have to do it again. We don't want to do that. So yeah, ceramic implant just a tool to give you a new tooth, which is a biomaterial, completely neutral to the body. Light can travel through. You can use laser on it and red light to like really shine into the bone.
Got it.
And like I said, at the end, the gum grows on top of it. That's the main thing. And it's an
Now I understand.
exo prosthesis.
I'm actually quite embarrassed that I didn't realize the difference between those that you're just telling. So the implant itself is actually going into the tooth. It's into the actual, like into the bone itself.
The socket, yeah.
The socket, to help that you're getting grafting, so that you have sort of like a leverage point to actually put in the actual tooth afterwards, is what you mean, correct?
Yeah, the tooth that you see out here, that's called a crown. Like a tooth crown, the enamel. So literally this tooth goes up until almost your nose. That's the root. Right. If you see your x-ray, you have huge roots.
Of course.
And if it's completely out, well, you need to give you a new root. That's the implant. And
so
we do
that
in ceramic. And we do that for over a decade, even though it was criticized a lot, even though it was ridiculed, everything. But I believed in it from the beginning. I've placed way more than 5,000 to 6,000 of those. And I'm still one of the world's, let's say, forefront on this side of things. If there would be nothing to do, I would be more happy. It's not about replacing ceramic implants. It's good that I have this under my belt, because that is why other dentists listen to me, because this is just a level of expertise and skill that not many have. But it works, trust me. Even though it's what we do in our clinic is science fiction for most dentists out there. And it's not in a bad way, but it is really literally, they don't really understand what we're doing yet. But that's why I say we're training. We have the Institute of Biological Dentistry, certifying. And there are good people out there, but it's way too little. We need more, way more. And I'm happy to share and co-elevate and collaborate. I'm not a competitive guy. I want to bring this and have the impact to change our profession.
Yeah, I mean, and I love that about you, Dom. You've always been more of a collaborative kind of guy. You're not somebody that's trying to hide in Germany and have everybody come see you. You know that there's plenty of people all over the world that really need this, and I'm sure your waiting list is quite large at this point, and you're quite busy with everything you got going on. So it's you're in training mode, which I appreciate. And I'm embarrassed to understand that I didn't quite understand the difference between an implant and a crown until just now. So
no, it's good that you actually asked this question, because I'm like the professor, so I also sometimes overlook that. Hey, what is the level of knowledge I'm talking to? So it's good if we have this for the listeners, because they might not even know. And I'm like, implant, root, no one understands what I'm saying. So it's good if you bring it down.
Well, it's just kind of funny to me, because I feel like I should have known that. But anyway, now I'm knowledgeable enough to know. But most of the people that are listening to this podcast are clinicians or people that are really interested in science and have a good sort of knack for these. But again, when it comes to, especially you don't know a lot about or as much about, like, it's really helpful to kind of sometimes define terms. And I actually did want to define one other term that sometimes can be confusing for people, which is cavitations. If you can just discuss a little bit about cavitations, what they are, where they come from. Like, I know we talked about your various processes here and nutrition and optimization, which I love, but like, what is a cavitation exactly, Dom? And like, how did you understand this from a very different perspective than how you trained?
Yeah, so cavitations is something you don't learn in university, for example. That's why it's oftentimes just straight up woo-woo for most dentists, which is not. It's literally a chronic silent inflammation in your jawbone. And it's a good description, actually. It's a cave in your jawbone, cavitation, because this is a part in your bone that didn't really properly heal into new bone. That's why I'm asking the question, did they remove your wisdom teeth? Because that resonates with most people in the Western world, because, again, just estimation, 80% of all you guys listening had them pulled, because it's standard of care, because we don't have space enough, which is a de-evolution. Anyways, it can happen. Now we get more and more clinical data, because we work with a lot of universities, professors Professor Sherr just recently brought out a really high peer-reviewed paper where he could literally show cavitations develop after taking out any tooth. He did it with premolars, which is these teeth there, but it doesn't matter. So I realized that very soon because I learned from very good people that that's a big thing. And because it's a massive, chronic, silent, no one hears about it. It doesn't hurt usually, unless you have neuralgia. But that this is a cave for anaerobic bacteria again, parasites, fungi, mold issue. In America, mold is huge. Mold spores tend to live in there. So you try everything and the mold doesn't go away. Look in cavitations or root canals. So the bone doesn't form. Maybe you had a dry socket. And this is usually a lack of preparation systemically. So when you take out a tooth, usually you go to the dentist, they tell you about the procedure, you get a local anesthesia, you get your pain medication, you get your cortisone maybe, you get your antibiotic, and that's about it. And that's like, tomorrow I see you for impacted wisdom tooth surgery. That's how I was treated when I was a kid. And I was 15 years old and my body didn't heal at all. I didn't realize that, but I came up with a lot of problems afterwards. So that's what happens. And what needs, and therefore basically your body is in a shock from traumatic surgery, way too rough. That's how we trained, really rough, fast, because then insurance pays for it. But for being fast, you have to open a lot, gives you a lot of swelling, pain. Like that's how I remember it.
Me too.
Body wasn't prepared. And because the body wasn't prepared and in shock mode, the healing didn't take place. And over time, there are specific chemokines in there called ranties, or let's just say molecules that usually would help rebuild something. But if they get chronically activated, they can cause all sorts of systemic problems. And again, the main issue is no one knows about it. And it's usually silent. It's a silent inflammation in the jawbone. And because there's no bone forming, because of a lack of nutrients in the first place, it's a good cave and hiding spot for, like I said, bacteria, parasites, viruses, fungi that we don't really want to have in our jawbone. There's fine in our mouth, but not inside the jawbone, traveling to everywhere. And there's also heavy metals, glyphosates, and also mold spores. So it's a huge breeding ground. And it's usually, if you ask now 99.9% of all dentists out there, they don't even know about it and they will tell you it's bullshit. It's literally not. So we include that in every single menu and treatment plan. If I know that tooth is missing, we will clean that bone and prepare your body so that this time when we do a surgery, you literally build bone. Because otherwise I do a surgery again and again and again. That's not why I do surgeries. I do that to help you heal. But if you're not able to heal, like in the first place, and I do it again, I'm not God. I have to just make sure to know how a body works systemically. So that's how most of what I brought mostly to all this is the nutritional side of things, the food design concept, the bone healing protocol, because it's systemically, it's like bodybuilding. There's a science behind it. It's not woo-woo. It's literally science. And apply these protocols and it will work.
Yeah. Why do you think that cavitations are not accepted by 99.9% of dentists? Is it just training and experience, or is it there's not the research to back it up compared to some of the other things, or what's your sense there?
The main thing is that is not part of the university curriculum. So you know how it is. For most doctors or dentists, when they have their license, that's kind of like the end game. But there are some that for me, it was just the entrance. So I continued education and learned more and more. So that's the first thing. And also, obviously, there's not a lot of industry behind it. So there's one guy actually from Germany. I would call him the Yoda of cavitations, Dr. Johann Lechner. Okay. He's already like 80 years old. He did the most research things, but it's only him. So obviously, most of people will not accept because he's then quoting himself again. You know what I mean? But now, because we're working with universities and younger professors, let's say not baby boomer generation, but professors that are our age, millennials, they're more open-minded. And they finally look into this. And like I said, Sherr just brought one paper out, but obviously is way too little. But if you look, so there's a specific chemokine in these cavitations. That's called rantes, R-A-N-T-E-S. You could also find it as CCL5, chemokine lignin 5. If you type that into Google Scholar or PubMed and do CCL5 and then multiple sclerosis, do CCL5 and cancer, do CCL5 and whatever, you will find papers and papers and papers and papers because medical world is looking for CCL5. Then the world doesn't know that's in their mouth. So that's where we're lacking just communication.
Right. So that's the ideal. So that's where this typical chemokine is found for the most part, is in the mouth primarily. And then it's associated with these other conditions is what you mean, correct?
Could be associated. Yeah, it doesn't mean that it's the main trigger, but there is studies showing high CCL5 coming from cavitations connected to breast cancer, for example. I would never say it's a causation, but it's there. I would also not say that chemokine lignin 5 or rantis is only specific to the jaw. It's specific to any ongoing chronic building site.
Understood.
It's oftentimes remove wisdom teeth, for example, that never heal. And that's the cavitation thing. But it's coming more and more and more. And there's actually a medical term now, is cavitations. Whereas 10 years ago, cavitation was more like a layman's term, but now the medical world uses cavitations for the research. It's not NICO or NICO anymore or FDOJ. It's literally cavitations. Also in Germany, Cavitationen then. Same. Okay.
Very good. Understood. And so
just imagine chronic sinus inflammation in your jawbone. You don't know about it. And maybe your trigeminal neuralgia is from that. Imagine, and you're suffering, or you migraine. And you have that for 30 years. And then there's just the biological dentist you see, and he takes out the root canals, cleans everything, takes out the cavitations, and you never have a migraine again. Imagine. And you just didn't know about it. Yeah. That's what I mean.
No, it's beautiful to think about it in this sort of more holistic perspective. But Don, one thing you mentioned that I think is interesting is you call it a menu, and you call your steak is your main course with the actual surgery. But is it something where somebody comes to your office and can choose what to do off the menu? Or is it like, no, this is your menu for this particular issue, right? I just want to be clear for people that, no, you're not going to like choose this and that and this and that. It's like, no, this is it's more like a pathway, I would imagine. It's
more
than
like
a menu.
A pathway. So we see each other just maybe more like an architect for optimal health, and want you as a guest or patient to be empowered to become the same. So a part of, let's say, our pathway is that we prepare you with the right nutrition before you even see us, that you do the right nutrients. But also, when you're here with us on site, there's a specific protocol. That's what I refer to as a menu. Kind of like in an example, it's not a walk-in dental office where you can get your pain fixed or your filling done. It's completely different. We plan everything remotely and see the whole case. And then to make this, for example, so it makes sense for you. A root canal removal and immediate implant, being it ceramic or titanium, is qualified as a high-risk procedure in medicine, in dentistry. For us, it's not. But we do have this oasis of health optimization and preparation, so we can do this. So I'm literally doing all the cavitations. Sometimes I do 10 root canals in one sitting, ceramic implants, no general anesthesia, nothing. Yeah. And I do an open sinus graft, which is another thing like lateral. And there's no pain, no swelling, or almost nothing because of all the things we build. So if that is not the case, then I would probably not approach everything all in one and let people fly in. So that's what I say by certain levels to it, and why this is more like, let's say, a very top-down approach. And therefore, for these bigger things, you literally can't choose, because this is
that's what I was getting at.
Part of it. There is the hyperbaric. You know the research better than me, why we need hyperbaric for these things. Obviously, I can't do it after lateral sinus graft, but that's the only exclusion. But everything else is working. Or the red light, or the IVs. We want to make sure you're in a extremely perfect, non-stress healing environment. And if you stay there for a couple of days, get you out of stress mode, get you completely focused on yourself. And once we're over the hump, let's say the first 2 or 3 days, and you're more sympathetic, then you can travel back. But we made sure that you heal. And you also get the blueprint for what to do the next 3 to 4 months, so that you continue healing, because bone healing is slow. You cannot just have a surgery and expect the body to heal. Right.
What average bone healing time in general, what would you say? And what do you see typically?
So literally to rebuild bone is 3 to 6 months. It takes long. But also there's good studies like Framingham osteoporosis study, for example. Depending on substrate, they only focus on I think it's femurs. The
hips, Hips
and femurs, and protein intake. So below 1 gram per kilogram, which is probably below 0.5 gram per pound, people have 30-day longer hospitalization than if they just eat 1 gram per pound. Like if you go above 0.5. So we do 2 grams, so 1 gram per pound we do at least for protein, to make sure that you have all the nutrients and building blocks. And then bone healing is actually way faster than you think, but at least 3 months.
Yeah. I mean, I've been able to speed it up over the years with that kind of intervention, protein interventions, health optimization interventions, and of course, hyperbaric interventions too, in combination.
And also obviously like the science behind bone healing, how that works is like you have certain not the macronutrients, yes, but you also have certain micronutrients like vitamin D3 from sunlight, vitamin K2, magnesium, zinc, boron, methylated B vitamin. That's all in my protocols so that you don't have to think about it. There's a ton of knowledge in that dentists that are biodentistry, that are certified, they all know this, but I don't feel that you have to you know exactly what's in the menu. It's just like, that's how it's designed over like years, like it's almost 20 years now.
Yeah. And even just
iterate, make it better, make it better.
Yeah. When it comes to doing some of that supplementation and bone healing protocols and things, are you doing any testing in patients before they come in, like asking them to do laboratory testing, micronutrient testing, antioxidant testing? Are you more doing it more like just sort of empirically because you understand what's required from almost anybody coming in the clinic at this point?
So we had phases. We had a lot of phases where we literally did blood work. We did ton of testing but because people usually fly in from all over the world.
Yeah.
We kind of developed, or I personally kind of developed algorithms on what happens. So I just basically need your vitamin D3 level and need to know how you're eating these days. And then because of my knowledge about applying nutrition functionally, if it's muscle training or bone healing is a little bit similar, we know that these protocols just work. It's timely tested over. At one point, it's probably empirical if you have thousands and thousands of people and it just works. You're going to
get like 90% of the people there.
And then, of course, as soon as you come in to being on the spot, we do more testings. We have an in-body scan to see your body composition, to see everything there. Maybe do some blood work if we need to, but usually we do blood work mostly when you come back because to see what's next. Yeah, maybe
I see.
To see heavy metal toxicity and all these things. But for that, there's so much knowledge in functional medicine, everything in there that you just have to basically do it and it will work. And
got it. So at some point you were doing a lot of testing, but you realized that it wasn't as required. And I do understand that people are coming from all over the world to see you, so that's not an easy thing to pull off. But I'm sure you're.
And actually, it is not really required if you really understand what you need for it. And you have a few critical things you need. You need to know if the vitamin D3 is like super low, right? Because that's something you definitely need. But then it's just literally kind of like building a house. And we go obviously with the 80-20 approach. There's always something that we have to individualize on the spot. If I see you in a person, but it's like yourself. There's so much information in it's also getting intuitive. If you have a lot of knowledge and tried and tested a lot on yourself with people that okay, if you do exactly this, and oftentimes we actually have a lot of people that are already on their journey to health optimization. So they have way too much on their plate anyways. They do too much supplementation. They have no more idea what they should eat because they have, they really don't see the forest for the trees anymore. So we kind of like narrow it down again and give them the path to optimal health. And then it works. It's adherence. And we're kind of like adherence specialists or accountability partners on the line and give a lot of data points. Hey, it's too much body fat. This is how you eat now. And this is obviously the oral surgery or that intervention is for me, or for what we do, is a good leverage to change your lifestyle.
Right.
Because you want to have that healed, right? You want to have it. And you have to do it for 4 months and you create a habit. And then that's why people usually stay on it.
Yeah. I love it. It's actually really a very significant correlation to how I think about hyperbaric therapy, Dom, in the sense that if somebody's had something going on for years and they want hyperbaric therapy to fix it, it's not likely going to be the solution to fix it. It's going to be a comprehensive health optimization perspective that's going to get them ready for hyperbaric therapy and actually have them benefit over the long term. And even sometimes, at least in my case, in the hyperbaric case, they may not even need hyperbaric therapy in the long run if they're doing some of the work to truly optimize on the healing optimization, the journey that they're on. So I think that's a very significant, that resonates with me a lot, the way you're thinking about it.
Yeah, 100% the same. Same, but like if you use an IV, sometimes people need that initial, let's say, liquid business card, so to speak, to get them on the journey, which is really
I like that.
the daily lifestyle, right? This is where the most impact comes from. That's the 80%. And I'm a surgeon, or I can't sit on your lap for the next 4 months. I need to make sure you're compliant and do these things. Then obviously make it simple. So these protocols are super simple. They're fun. So it's literally I invented thinking in nutrients and have an algorithm how to calculate everything. So they're also a little bit accountable for what they're eating on a daily basis, like an architect. So we rebuilt the complete gut from the mouth. And obviously the biggest detox is taking out that previous dental repair.
Yeah. Let's talk about the mouth a little bit more when it comes to the microbiome, because I think this is an area that is new, and I know that very important for you. You talked a little bit about earlier how the amount of microbiota that we have in our mouth is comparable, maybe only second to maybe the large intestine within our GI tract, at least, as far as how much we have, per square, whatever, like real estate wise. How do you think about rebuilding the oral microbiome? And I think maybe this can also be related to, toothpaste, mouthwash, those kinds of things that you think about too, and how, for example, you said you've gotten rid of all the bad stuff, right? You've gotten rid of the cavitations, gotten rid of the root canals, and you've worked on all that. Or even while you're doing all that, you're still working on optimizing your mouth. What are some of the steps that you think that you've seen to be the biggest leverage points here for people?
Yeah, thanks. Of course, the biggest detox will be taking out that stuff. That's kind of like setting the terrain, making this ecosystem natural again, because obviously no dental repair is natural, right? That's number one. But then it's also the substrate. So the whole nutritional protocol, basically eat real food, focus on the nutrients, will create within 12 to 24 hours a complete shift in your microbiome. Because you also swallow about 140 billion bucks per day, which make up 50% of your gut intestine microbiome.
Yeah. Right.
There's a huge university in my hometown, Tübingen. You can Google that. There's a big microbiome, let's say, research project. And I know some of the researchers there, and literally it only takes 12 hours if you change nutrition to change the microbiome. That's how fast it goes. It's insane how fast it is. And then, yes, your daily oral healthcare protocol or routine is super important, because in the first place, if you are nuking your oral microbiome on a daily basis with chemicals that are designed to disinfect, that is our supermarket oral healthcare aisle. It's
Listerine, baby.
Huh?
Listerine.
Yeah. Exactly. And this stuff, for example, the mouthwashes, they are super acidic. They actually were designed to clean floors. And they're ethanol based, so there's alcohol in it. They're acidic. There's actually the opposite of something healthy for your teeth. Yes, they might disinfect, but we do not want disinfection. We don't actually want to kill your microbiome. We want to modulate your immune system and balance the oral microbiome. So instead of this chemical mouthwash stuff, just ditch it in the toilet, clean your toilet with it. Use oil pulling. Ideally, use coconut oil pulling. That's actually for free, because you probably have a jar of extra virgin coconut oil at home cooking.
Of course. Yeah.
The only thing for this is, so it's an Ayurvedic strategy, coconut oil pulling. You just take a teaspoon of extra virgin coconut oil, put it in your mouth, let it melt, and switch it around for 5 to 15 minutes, which is soothing to the gums. It's Ayurvedic. The only tricky part is you have to do it. It's consistency and adherence to that. So I would do that every day, every other day at least. And only then it works. It's not, some people ask me this, is coconut oil pulling like better than toothbrushing? Or can coconut oil pulling be exchanged for toothbrushing? No. Coconut oil pulling is literally just a mouthwash, and it's cleaning and everything. And it also, because it's a lot of toxins in your mouth are fat soluble, you spit it out later. It's also detoxing, and it's also antibacterial and antiviral because there's lauric acid in it. So it's just an amazing strategy that almost costs you nothing, and there's no side effect, no trade-off versus the other one. But yes, you still need to brush your teeth. That's also another question I get a lot is, first of all, what about fluoride? So all real biodentists are team no fluoride. Fluoride is what you learn in dental school. Fluoride is there to make your teeth hard and protect. And maybe that's correct. They actually make your teeth hardish, but more brittle, because that fluoride goes into your tooth enamel and changes the structure. So there is a protective mechanism for that fluoride, but we know now that fluoride is a neurotoxin. We know it's going to your thyroid. It's also affecting the IQ of your children. There's a big movement out there in America right away anyways because of RFK, and I think Utah banned it and Florida banned it, or almost banned it already. Fluoridization of your water. So it's going to be very soon that they do that for toothpaste. And there is actually a healthy alternative that you can use that has zero side effects. So I personally think, why should I use something that maybe has a negative side effect for my health? If I could use just a natural thing. And this is called, if you go fluoride free, choose a toothpaste with an active ingredient. And the active ingredient is called hydroxyapatite. And calcium hydroxyapatite is what your enamel is made of anyways. So you brush your teeth with hydroxyapatite, let it sit on your teeth. You can spit it out, but don't rinse it out, and then it will just be absorbed. Question again would be, is there a problem with nano hydroxyapatite, or what would we use? Nano is bad. We use micro hydroxyapatite, surface activated, but I don't think that nano is too bad, to be fair.
Why would nano be bad? Is it because it would get too absorbed? Is that the problem? Or?
I think it's a social media thing, but I'm getting this question all day, every day.
Yeah.
You don't need to have nano, but I don't personally think it's too bad. Yeah, it's an absorption thing. So to be on the safe side, we use micro, which is a bit bigger in a molecule than nano. Sure.
Yeah,
we have a surface activated one, so it sits there. So that's amazing, because a lot of people go fluoride free, and what they usually do, they go see a health store like Whole Foods or Sprouts or everyone. Everyone might be better as a very local one, but let's say Whole Foods and Sprouts.
The most expensive.
Yeah, exactly. Whole Foods and Sprouts. I make it a hobby. Wherever I go in this world, I see the supermarket aisle for toothpaste and hygiene. Of course I do.
Yeah.
And literally, in normal supermarkets, it's impossible to find anything anyways. But if you go to a health food store like Whole Foods, 90% of these toothpaste, or I would even say 100% in most of them, have no active ingredient. So if you go fluoride free, you need an active ingredient, because otherwise the protection is missing. Essential oils won't cut it. Yeah, essential oils don't give you nutrients and building blocks for your teeth.
Sure.
Then your kids have tooth decay even though you're doing everything right. That's what happens a lot. Because, of course, in an ideal world, you would only eat real whole foods, and you focus on protein, and you focus on meats and fish, and you don't do any processed foods. But let's face it, all of us out there eat some processed foods, and they are completely lacking nutrients. And all of us also are not always in sunlight and have probably too little vitamin D3. So I personally would not need to brush my teeth, because my nutrition, and probably you don't need to do, because the nutrition is on point, but I still do it because I want to have that protected. But this is something I really need to raise, is find an active ingredient toothpaste. And I literally think is not in stores yet. You find it on Amazon. That's not
crazy. Yeah. I have to check mine.
It's crazy, right?
I have to check. Now I'm going to check my kids. I think it has hydroxyapatite, but I'm going to double check.
Double check.
Yeah. What about so you talk about the coconut oil pulling, which is a meditation in itself. You're doing it for 5 to 10 minutes. But that's good because it's going to slow you down. The other aspect, of course, is the flossing piece. And the reason I ask here is, when you talk about your gums bleeding, for example, and this is, a sign of a leaky gums, and just like if you have a leaky gut, if you're flossing, and this occasionally happens where you get blood when you're flossing, is this another sign of leaky gums, or is this something that, you've just been causing more trauma to your gums, for example, and causing, that kind of thing?
You're right. That's a good question. So flossing, if done correctly, is a good thing, because let's face it, there is oftentimes sticky food in between your teeth. And then if you're very gentle with your floss, you can get it out. However, my critique is what you're saying. Oftentimes we're not as skilled with our hands. We just yank it through or rip it through, and then it bleeds because of the flossing. Then you're causing microtrauma.
Yes.
If you're not as skilled with your hands, I would probably rather use a toothpick, or let's say a water pick, or like there is these, I don't know how you call it, like little hooks where floss is in between, a C hook or whatever. I know
you're talking about. My kids have those. We have
those oftentimes work. In perfect scenario, your teeth never had any dental repair, so they're kind of like very tight together. You have all the nutrients you need. You're on a supportive diet, and literally there's no food in between. But I know most of us had dental repair, so there is stuff stuck in between. So use flossing. It's fine. Just go maybe find a natural one again. Could be made from pineapple fiber. Could be, ideally you don't use the conventional one, because it's again full of microplastics and stuff.
Yeah,
I don't want to fearmonger in this case. I think it's still fine to use the dental floss. But if you want to go really good, then find a natural one. Would be better.
Got it.
But
are you doing?
Be gentle about it.
Yeah. Are you using any microbiome support for the mouth now? Like any like probiotics for the mouth or prebiotics or anything like that specifically? Or is it more just focusing on diet, focusing on good hygiene is the main things?
That's the main things, but yes, sometimes I would use an oral microbiome, oral probiotic for sure. If there's like if there's a big, let's say, dysbiosis happened before, or you had a lot of antibiotics and it's just eradicated, then it might be a good idea to use some. Yeah, probiotics can have good benefits. So actually, I've designed a toothpaste that is more like a supplement because, like we talked about it before, and that's the most asked question. Dr. Dominik, which toothpaste do you recommend? Usually none. So I had to come up with some, and it's going to be available in America also soon, but for now only Europe. So it is coconut oil base or MCT, like very clean. And we have hydroxyapatite in the micro version, a surface activated, but I also have xylitol in it and lactoferrin for your gums. And we do have a very specific probiotic strain in there. It's more like a, I would say you can probably call it strain. It's more like a police that modulates. It's nothing to like be too crazy. It's a subtilis. It's more like a spore. It's a patented
Oh, so like
version.
a bacillus, kind of like a bacillus one, maybe potentially. Okay.
Yeah, a subtilis salt, exactly. Yeah, but
very cool
patent version. So it's really good stuff. It cleans obviously, and it's designed for adults and kids. Why would you do the difference between kids and adults? They need the same nutrients and they need the same support. So brushing is still important. Keep that on your teeth. But then as soon as you have your oral hygiene regimen, because you asked the meditation aspect of coconut oil pulling, I personally just do it in my no extra time. If I prepare breakfast in the morning, I do it at the same time. Or if I commute, I have these. So I don't sit somewhere and do this only for 5 minutes because that's sometimes missing. But if you
it's hard to
kind
find,
of like make a habit out of using it, knowing, oh, that's my anchor to do coconut oil pulling. Literally could be frying your eggs in the morning. Oh, then that it needs to become a habit. And then you brush your teeth twice a day with a clean toothpaste. You use that flossing. And what we also do is copper tongue scraping on top of it. It's actually the first thing I start in the morning is tongue scraper. You know what that is?
Yeah, I've seen them. I don't use one though. No.
So tongue scraper is another Ayurvedic strategy. Usually when you go to a dental office, they're made out of plastic, which is fine. You can also get stainless steel, but plastic is in itself a little bit rough from the surface and bacteria tend to grow on there. So Ayurveda would use a copper tongue scraper because copper in itself is antibacterial, so nothing lives on there and it lasts forever. So, and the thing is, again, it's a habit. Anchor it to, you wake up in the morning, you look into your mirror, for example, and then you just pull that thing out and scrape your tongue 10, 15 times, investment 10 seconds, and it will help against bad breath, overnight debris, food particles. You don't like scratch it. You really just scrape it gently. You don't want to kill your tongue. Just very gently. And over time, there's nothing to scrape off. But at the beginning, it's more like coaty, furry. And this helps against bad breath, such as the coconut oil pulling too.
Right.
Without no side effect, just do it. So copper tongue scraping, coconut oil pulling, clean toothpaste, maybe flossing. And then as soon as you have this all covered, nutrition.
Yeah.
And the right micronutrients for building teeth hard as stone from within. So outside brushing, maybe the toothpaste, the saliva, but inside, vitamin D3, K2, magnesium, zinc, boron, methylated B vitamins, biotin. There's a whole host of things that I've designed into a product over the years to make it just simple. Invisible tooth guard. What I said before. The
cool.
Tooth shield.
Not tooth shield. That's right. That's what it's called. Cool. And one thing I wanted to also just talk about briefly, Dom, was on the myofascial, myofunctional side of things, as far as tongue posture, airway health, mouth breathing. Do you have anything you want to say about those as kind of as initial or additional things to add?
Additional. Again, you have to see it top down. So mouth breathing is an adaptation, right? Because you don't get air through your nose. Why are you not getting why do you not get air through your nose? That's the first question you should ask. So it could be, again, oftentimes it is diet or nutrition related. Just immune triggers such as literally dairy is a huge one for that. Swollen tonsils, clogged up noses, oftentimes just dairy or other, let's say, food intolerance. But dairy is a huge one there. Even raw dairy. Even though that's a big trend right now on social media.
Yep, I agree.
A huge trigger. You agree, bro? Yeah, from a medical point.
I do. Yep.
yeah, so I've seen that a lot. I personally had that. And then also obviously growing too narrow, not being breastfed could be collapsing and you're just too tight and don't get that. So if you have nutrition on point, and again, what we talked about before, setting the terrain, dental repair, metals, root canals, all these things can also lead to chronic swollen tissues, chronic inflammation. Again, this needs to be taken care of. If that is all set and you still have an issue with mouth breathing, then obviously you need tongue posture training to do that at the same time. Your tongue needs to be up behind your incisors. There's wrinkles. It's called papillae. Your tongue literally goes there.
Yeah, up there.
And some people can't do it. That's the question you had.
I just
Maybe
learned
you
this
have a
recently.
tongue tie.
Yeah.
That could be a problem that's related to the posture. Could be an additional information you need. But first of all, train that before you do any surgery there. But it could be, and it sometimes is necessary to cut the tongue. But I would only do this again, the surgery, even though I'm a surgeon, as the last resort. And have a good myofunctional, functional dentist that focuses on airway health. Look at this. But literally figure it all out. Also, you could also be an allergy to your cat at home, that your nose is always clogged. Why is that blocked in the first place? Find this. And then tongue posture, yes, airway health is important for sure. But again, if there's a root canal or metal in your mouth and you do all these things, you might have didn't start at the root source.
Right. So just working on your, no, you did. Yeah, I think
tutorial.
No, absolutely. I mean, just working on tongue posture is not going to be very helpful if you have a bunch of metal in your mouth and heavy metal toxicity, right? So
exactly. The same thing applies for your tongue posture is amazing. You should train that. It needs to be up there. But the same thing for mouth taping. Mouth taping could be amazingly beneficial. But if the source is the heavy metals and the root canal, you should not do this because you need that air and you can't get it. You can't train really the nose breathing if everything is inflamed from within from another trigger. That's what I mean. Like mouth breathing.
I totally understand.
You understand.
Yeah, no, it's perfect.
It is amazing, but you need to know when to strategize it in. When is the right timing to use that tool? It's a tool.
Yeah, I love it. So Dom, at the end of the podcast, I mean, we could go on forever. I have like about 1 billion more questions, but we'll have to, I'll just chat with you after the podcast about this. But at the end of the podcast, we ask everybody, this podcast is called the Smarter, Not Harder podcast. And at the end, we ask everybody, what are 3 ways that we all can live smarter, not harder, given your areas of expertise, given your life, your family? It doesn't have to be anything related to dentistry if you don't want it to be, but what are 3 ways that people that are listening can kind of take away to live smarter, not harder from your worldview, your history, your experience?
Yeah, I think the main thing is that you first understand that you have a body that you live in and that there's always a way to improve health if you take responsibility. So step 1, take responsibility. Step 2, in that world of social media, where you probably most likely don't see the forest for the trees anymore, find a coach, find someone who helps you, who has been there, help you on your health journey. Could be us starting from the mouth, could be Scott, but you need someone that is an expert coach who will guide you. Trust me, you'll save so much time and effort
100%.
and mental capacity. Even though we are biohackers or we train, I don't call myself that way, I'm using track wearables, not needed. Don't over focus on data. Focus on getting your intuition back. Start with the nutrition, start with these oral healthcare strategies I just alluded to. It's simple. And then do baby steps, and monitor yourself. You are in charge now, I think. And then obviously for an idea that you just learned is, if you already do all these things and you're still not superhuman, now you know there might be dental repair lurking in the past inside your jawbone that you might need to optimize. But yeah, have fun doing it. It's your journey. Have fun. That's the main thing. Have fun.
I love it. And having 4 kids as you do and I do kind of forces you to know that life is a little bit more about just doing surgery every day or just working on somebody's mouth. And even though we love what we do, like having fun while we do it. And I love your emphasis on finding somebody to work with, a coach that you trust. There's a lot of information out there that does not apply to you, I promise. Dom and I can tell you that. And so please, the new supplement, the new tool, the new technique, like you got to be careful out there and find somebody that you can trust.
Exactly. And then I think you save a lot of time and stress, mental stress. is the worst. Like placebo is actually a thing, right? Nocebo, placebo, we see it every day. A lot of people that are freaking out because of everything. That is what makes you sick. Yeah. Some people are just relax about things. And then you will find the way. Just know that there is a way and you are in charge. And we're here to help and guide.
I love it. I love it. So Dom, tell people where they can find out more about you. Also, I know you're doing a lot of training now with practitioners, and that are a lot of practitioners that do listen. So tell us, where we can find out more about your training and your office and your supplements and everything else.
Okay, thanks. So about me, probably drdomeofficial.com is easy, or Instagram, drdome1. That would be a thing. Then for all dentists listening and also all guests or patients out there, I'm training the true Biodentistry Global Standard through that Biodentistry 3.0 certification. It's not just a course, it takes a while. But if you're interested in that, it's just the Institute of Biological Dentistry. It's also going to be linked on that Dr. Dome official page. Happy to find you there, because trust me, dentists out there, we need to change our profession and work hand in hand. And we have an amazing opportunity here to really uplift our profession and be the change we need to see in others. And patients or guests are looking for you all over the place. You cannot imagine how many we have. So that's why I'm bringing this to the world. That's number one. And companies for America, we have Supreme Oral Health, where you get the tooth shield and the toothpaste soon, hopefully in September 2025. But if you're listening in from Europe, my company there is Subs Nutrition for over a decade. And the same to tooth shield in Europe is called Bone and Teeth supplement formula. So yeah, Institute of Biological Dentistry. And then obviously my clinic, DN Aesthetics. But Dr. Dome Official kind of like links it all together. Dr. Dome on Instagram. And then, yeah, hopefully there's something for you there.
Dude, this has been great. It's really nice to see you. I'm sorry it had to take a podcast for us to hang out for a little while, but you and I are busy doing all these things. But I wish you the best as always, and hope to see you sometime soon in person, man. It's really good to see you again here.
Yeah, thank you so much for having me. And same. Yeah, I can't wait to see you in person again.
Thanks so much for tuning in to another episode of the Smarter, Not Harder podcast, where we give you 1 cent solutions to $64,000 questions. And Dr. Dom is a fantastic human physician, educator, doing all the things on the forefront of biological dentistry. I hope you learned something here. If you're interested in Dom's work, please check his work out, his books, his supplements, where he's going to be speaking next. He's just a fantastic guy to listen to and really on the forefront of all this. If you like this podcast, don't forget to like and subscribe below. Share with your friends and family, your colleagues. Spread the word, spread our wings. We'd love to hear what you have to say about our podcast too. Leave us comments, questions. We're here for you. Enjoy the day, and we'll see you next time.